Do supplements play a role in your general health as well as in your multiple sclerosis? Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for 38 years. And I've said in my recent videos that I am going to be focusing on keeping my general health as good as possible so that my MS has the best chance of staying stable. I've talked about exercise and I've talked about nutrition. Today, I'll be talking about supplements. Now, supplements are not something that I think is totally necessary if you eat a really good diet. If you eat a balance of foods, stay away from processed foods that tend to have very little nutritional value. Eat as much fresh food as possible, fruits, vegetables, whole grains. You know the drill. You've probably heard this from lots of different sources. Trying to keep yourself as well nourished as possible without overdoing it, of course. And that is true whether or not you're a vegetarian or a vegan or you have certain food allergies or sensitivities. You can still craft a diet that is rich in nutrition. And if you're not sure how to do that, there are lots of sources and you can talk with your doctors about that. But today I wanted to talk a little bit about supplements in particular. And as I've promised you, I am not going to recommend things that I myself have not tried or would not try. But I do have a number of different sources, and some of them you will recognize, and perhaps some you won't. But I think it is interesting just to see what is the commonality. Are we getting the same recommendations from different sources? Because to me, that lends some credibility and trust that perhaps that supplement would be a good one to try. So let's go ahead and take a look at several different sources that I have been able to find. And what do they have to say about taking supplements to benefit multiple sclerosis? Well, first we'll look at what Dr. Aaron Boster has to say, and I think many of you already follow him. He's been on YouTube for quite a while. He started out with the Cleveland Clinic, and now he runs an MS center, and it is affiliated, I believe, with the Cleveland Clinic. He's become quite well known for good information about multiple sclerosis. And I put the link to his video here, and I'll also link it down below, as I will with all of the videos that I'm going to be looking at today. But the video that we're looking at is multiple sclerosis supplements. People with MS should take these 4 supplements. And let's just go on and see what the 4 are that he recommends. In short, he's looking at having us take a multivitamin, vitamin D3, a probiotic, and flaxseed oil. The multivitamin is somewhat assuming that people tend not to eat a wide variety of foods so that it's possible that we're not getting all the minerals that we really need to be getting. Vitamin D3, as you will see, is universally recommended by everyone that I have been looking at, and certainly you'll see that today. And we'll talk a little bit more in detail about that soon. Probiotics, once again, I think that's a fairly common one to be recommended because it does help you in so many ways managing your gut microbiome. And we have learned so much about how important it is to have a healthy gut, and the bacteria that are in it need to be in balance so that your general health is good, not just your multiple sclerosis, but your general health. And as you know, I've been really interested in what I can do to keep my general health as good as possible. So probiotics are a very, very good thing to be doing. You can get that again from food. If you eat a lot of yogurt or other fermented foods like soy sauce or kimchi or sauerkraut, but it's probably easier to just take a daily probiotic supplement. And then finally, flaxseed oil. The benefits of flaxseed oil for everyone, and particularly for folks with MS, are really starting to become better known. And so these are the 4 that Dr. Boster recommends. And as I have said to you, I am not going to recommend anything that I don't take myself. I don't actually take a multivitamin, and I've thought about whether I should or shouldn't. And through the course of this investigation, I've been kind of leaning on maybe doing it. But as you'll see later, I think there are some important considerations. I already do take vitamin D3. I already take a probiotic, and I have not taken flaxseed oil, but I do put flaxseed in my oatmeal every morning. I'm looking into taking flaxseed oil. I think that I may try that, because I do see where the benefits of that might really be worth it. I don't like to take many supplements and vitamins. I'll tell you that right now. I keep a pretty limited supply in my medicine cabinet because I don't want to spend a lot of money on things that may or may not even be helpful. But I do think that there are sound reasons for taking all 4 of these. Next, we'll take a look at Dr. Brandon Bieber's information about the supplements that we can be taking for multiple sclerosis. The link again to the video I will put down below. It's right there. The title of his video is Multiple Sclerosis Supplements, and he lists them right there: vitamin D, omega-3, biotin, vitamin A. He goes on to other ones, CoQ10, and more. But the main ones that he talks about are these following. And I've left the timestamps up there, so if you go and watch his video, you can go right to the particular nutrient that he's talking about. And just like Dr. Boster, he recommends vitamin D, but he does have the caveat that vitamin D may or may not in and of itself, if you take it as a supplement, may not be the magic bullet.
On average. And again, we're really looking at vitamin D deficiency, so vitamin D deficiency is associated with more lesions in MS. Now, it's not so clear that actually taking vitamin D is beneficial. This is from Cochrane's evidence-based reviews, and they looked at 5 different randomized trials for vitamin D supplementation versus placebo, and on average, the odds ratio is 1. In other words, there's no benefit to vitamin D whatsoever. However, these were smaller studies, and a lot of them use lower doses, so it's not so clear. It's possible that vitamin D isn't actually beneficial, but there's confounding with another factor, which is ultraviolet radiation exposure from the sun. And in my personal opinion, the evidence connecting the sun and multiple sclerosis is much stronger than the evidence connecting vitamin D and multiple sclerosis, and I have a separate video on sunlight in MS. Nonetheless, I definitely recommend vitamin D supplementation in MS just in case.
Sunlight, because sunlight is the way that we process and make vitamin D, is probably the thing that we need to be focused on, because there are studies that show that people who get more sun exposure are less likely to develop multiple sclerosis. So that was an interesting clarification that we might be thinking about. Another thing, again, just like Dr. Boster, he's talking about getting omega-3s from either fish oil or flaxseed oil. And studies seem to be showing that flaxseed oil actually has more omega-3s in relation to omega-6s, which are not good for you. Well, they're not good in the amounts that we tend to get in our diets. And the ratio of the omega-3s to the omega-6s is better in flaxseed oil than in fish oil, but there's certainly nothing wrong with taking fish oil if that's what you have. The next thing that he talks about is biotin, which is vitamin B7. And there are a lot of good things that studies seem to suggest can happen for folks who take biotin. I know that a lot of folks try taking it to improve their skin, their hair, their nails. And studies are a little bit divided on whether that's helpful. But if it's going to help all those things, it probably could do some good for nerve sheaths as well. So for multiple sclerosis, it might very well be useful. And there's no harm in really taking it. at least if you keep the doses reasonable. It's not harmful, so it might be worth taking. You can get it somewhat from food. I know that there's some in eggs, there's some in milk, so you might be able to just get it from your diet. The last thing he says is vitamin A, and that's a little bit of a problematic one. I know that for the most part, people who want to get more vitamin A don't take vitamin A as such, because if you take too much of it, it can actually be harmful. So most people will take beta carotene if they're interested in getting more vitamin A. Beta carotene breaks down into vitamin A in the body, but it is not harmful. You can also get a lot of that from different foods, the ones that are colored orange, like carrots and pumpkin. But those are the 4 that he recommends. If you watch his video, you'll see that he does talk about other ones like CoQ10. But these are the 4 main ones, and we'd like to keep our list pretty short. And again, I have taken the top 3. Vitamin A / beta carotene, I have not really supplemented so much with that. I do try to get my vitamins from food whenever possible. In our household, we eat a lot of sweet potatoes and a fair amount of carrots, so I think I do probably get quite a bit of this vitamin A that he thinks is possibly helpful for MS. Next, I looked at a video from the National MS Society, and again, the link is there, Supplements and MS. And I really like this one because, of course, I'm kind of biased, but a lot of the research on what's mentioned here comes out of Oregon Health and Science University, and they are the folks that provide neurological support for me. And they're also the ones that did my cancer surgery. I think very highly of OHSU, so it always catches my eye when I see that scientists from OHSU have something to say on a subject. Well, as far as the supplements go, they had some good information here, so let's take a look at what they've got. And again, they talk about vitamin D. This is the universal one that all of the sources I've looked at will talk about as a potentially helpful supplement for multiple sclerosis. They have some information about it, and so it's high time I tell you a little bit more about vitamin D, right? So here we go. I like how they've laid it out, so I'm going to use their slides to help us understand vitamin D and what it's all about. And it says here that vitamin D is a fat-soluble vitamin, so it dissolves in fat. It's obtained from sunlight, some foods, and supplementation. So there's a number of sources you can get your vitamin D from. It regulates calcium absorption in the body and is needed for bone health. And I think you probably have heard enough about that bone health and calcium deficiency seem to be kind of related. Lately, that's been a little more controversial about what the role of calcium in the body actually is and how easy it is to have too much. But be that as it may, vitamin D is very good for helping with bone health. And then finally, it regulates the immune system, which includes anti-inflammatory effects. And this is probably the part that's most useful for multiple sclerosis. And as mentioned above, there are dietary sources for vitamin D. And as you see there, the international units per serving is important. I've seen all kinds of ranges for how much we should be getting. If you take supplements, the recommendation is anywhere from 2,000 to 5,000. So it's a good thing to see how much you could get just from food. Cod liver oil, 1 tablespoon of cod liver oil has 1,360 international units. So that's pretty good, because if you just take that, you're already more than halfway to at least the 2,000 IU recommendation for the dosage. Salmon, likewise, at only 3.5 ounces of cooked salmon has 360 international units. That's not bad at all. As you can see, it starts to go down pretty quickly, though, the amount of vitamin D in these various foods. Tuna fish only has 200, non-fat milk has 98. Cereal, well, if it's vitamin D fortified, it has 40. I guess, I don't know. I mean, what is the difference between eating a cup of cereal and just taking a pill. I don't know. It seems to me if it's added and not integral to the food, maybe you're better off just taking a supplement. One egg has 20, and 1 ounce of Swiss cheese has 12. So that just gives you some idea of how easy it is to get vitamin D from your food. But vitamin D is not without side effects. If you take excessive amounts of vitamin D, and excessive is in the eye of the beholder, I would suggest that you talk with your particular doctor about this, because your system may be more or less sensitive to vitamin D, and between you and your doctor. And it doesn't have to be your neurologist. I suppose if you have a good primary care doctor, or if you see a nutritionist, you could get this same information. But here are some of the side effects that you might end up dealing with if you go too heavy on the vitamin D dose. Nausea, kidney stones, headaches, muscle weakness, which is something we with MS really can't afford, vomiting, excessive thirst, pain, or excessive urination. And these are side effects that sound kind of serious in some cases. So I had not really heard about all of these before. And again, vitamin D is pretty safe in most doses that people would take, but this is just something to be aware of. If you take vitamin D and you start to have these kinds of symptoms on a regular basis, you might want to think about your dosage. And in the video, they do also talk about other supplements, and I will not go into detail about these here, but here's what they do recommend. Omega-3 fatty acids, which we've already talked about and which I do take. Antioxidants like vitamin C, and I do take vitamin C, and any antioxidant is good for you in general. And again, general health is important. Antioxidants can very, very much be useful. Biotin again is being recommended, and also B vitamins in general. B12 in particular, because if you have MS, and especially if you don't eat a lot of meat, you're not getting a lot of B12 in your diet. And B12 is important for nerve health, so I do take a vitamin B12 supplement, and also just a B vitamin supplement, a balanced B50, I think it's called. So it has a lot of different B vitamins in it. And I think these are very good for your overall health as well as for MS in particular. There are a lot of naturopathic doctors who talk about the importance of supplementation and diet for all kinds of reasons, for good health in general. Dr. Terry Jacklin is talking particularly about how to transform MS naturally. I would not want to go overboard in assuming that you can treat MS naturally. I think some people have had a lot of success with that, and Dr. Terry Walls comes to mind. She has a whole diet protocol that pretty much talks about how to manage multiple sclerosis through diet and nutrition rather than through medicine and other medical interventions. But I don't know that everyone is going to have that kind of success, so you might not want to lean on that too heavily. But I do think that she's got some good ideas here about the supplements that are helpful for multiple sclerosis. So let's take a look and see what she recommends. And like everybody else, she says vitamin D is important for managing multiple sclerosis. So I've got that on the list, and of course I take that. Fish oil, so she's coming down more on the side of fish oil than flaxseed oil, which is a little interesting. But it's not bad to take fish oil. It's just to be aware that flaxseed oil might actually be better. And certainly if you're vegan or you just want to limit the amount of fish that you consume, you might want to go with flaxseed oil, because bear in mind, and of course Dr. Jacklin points out, that some fish oil, if it's not good enough quality, it's going to have possibly pollutants and contamination from the water in which the fish were swimming. So you do need to be a little careful with that and make sure that you get yourself some good quality fish oil if that's what you decide to take. And again, she recommends probiotics, which I do take, And she recommends B12, and I just got through talking about the importance of B12 for those of us with multiple sclerosis, and especially true if you are not a meat eater. And then finally, she talks about a multivitamin with a good B complex in it. Now, she talks a little bit more about multivitamins and how important it is to get a good quality multivitamin. She specifically says, don't go running out to Costco and get the big giant jar of Kirkland brand multivitamins. You need to make sure that you're getting a really good quality multivitamin. And you can do a little research and find out what the good brands might be. She talks about the importance of looking for, particularly for USP GMP certified supplements. And you can see the little logo on the package of vitamins, on the bottle or whatever, that will tell you what the certifications are. There are a lot of these little logos that don't really guarantee anything, so do be careful. Vitamin manufacturers are great at putting things on vitamins that make it look like there's some kind of certification when there really isn't. So be sure you look for these two, one of these two. It doesn't have to have both, but one of the two is important. The United States Pharmacopoeia or Pharmacology is the USP. That's what that stands for. And that is a compendium of drug standards that include assays and tests for determining drug strength, purity, and quality. USP is recognized by U.S. federal law, published by the authorities of the U.S. Pharmacopoeia Convention. There's a link there, and I'll put it also down below. And then the GMP is good manufacturing practices, and it's also referred to as CGMP, or current good manufacturing practice. It's the aspect of quality assurance that ensures that medicinal products are consistently produced and controlled to the quality standards appropriate to their intended use and as required by the product specification. So you can see these are kind of standards that transcend any particular brand of vitamin. That is an important assurance to have if you're going to be taking a vitamin and putting that in your body every day. You want to know. Finally, I just wanted to take a look at the Mayo Clinic website and what they have to say about vitamins for multiple sclerosis. And the question that they ask is, do supplements make a difference? This is interesting too, because the Mayo Clinic, I believe, is pretty authoritative. They keep up with what the latest research is, and they're pretty conservative when it comes to making recommendations about things. So when we look at their article about whether supplements make a difference, their response is basically, as it says down here, the question of whether large doses of vitamins are beneficial is controversial. To be most effective, vitamins need to work in careful balance. A high concentration of one vitamin might cause a relative deficiency of another. And that's an important consideration. And as they say here, vitamin D may be an exception. So far, vitamin D is one of the most intensely studied supplements for multiple sclerosis. For several years, there has been a growing interest in the role of low vitamin D levels and an increased risk of MS attacks or exacerbations. Current research suggests a possible relationship between the two, although more thorough studies are needed to establish a definite link. The connection between vitamin D and multiple sclerosis is supported by the association with exposure to sunlight, as we talked about before, and the risk of multiple sclerosis. There is a higher incidence and risk of MS in countries away from the equator. And I made a video about that very thing, and I can link to that below. And it says here that the recommended dietary allowance for adults is 600 international units of vitamin D a day, and the amount increases to 800 a day for those older than 70. Be cautious with doses above 4,000 IUs a day, because they sometimes may be necessary in people who are deficient in vitamin D, but large doses may also carry increased risk. A suggested maintenance dose to consider in patients with MS is 2,000 to 5,000 IUs daily. And I'll just tell you right now, I take 5,000 units daily, and I recently had some blood work done, and my vitamin D levels were excellent. So I think that is the right amount for me. That doesn't mean that's the right amount for you. You might want to work with your doctor and figure out what is the right dosage for you. You may not even be deficient in vitamin D, depending on your diet and how much sun exposure you get. So before you start supplementing, you might want to check your vitamin D levels. I know that that isn't a standard part of blood work, at least in the United States, but if you ask your doctor for that test in particular, they may well want to know that level themselves, and so they may authorize that, in which case your insurance will pick it up. Otherwise, you may end up paying for that part of the test out of pocket, or so I hear. And this goes on to say that fruits and vegetables contain vitamins and other nutrients in useful proportions, working together to play their roles in good nutrition and disease prevention. For most people, even those with MS, the most reasonable course of action is receiving the recommended amount of vitamins from dietary sources such as fruits and vegetables rather than vitamin supplements. If you have MS and are considering vitamin supplements, talk with your doctor first to determine what vitamins and doses he or she recommends. More research is needed, but high doses of vitamin D seem to be most helpful to people with naturally low blood levels. Your doctor may recommend a blood test to determine your baseline vitamin D level and follow-up tests to determine when your level becomes normal if a supplement is recommended. So, yeah, you can take it for a while, and if you get your blood up to the right level, you may not have to continue to take vitamin D. But that is the recommendation of the Mayo Clinic. And as you can see from looking at all of these sources, the common denominator does seem to be vitamin D, followed pretty closely by probiotics and either fish oil or flaxseed oil. There are some others that various doctors recommend, but those three seem to be fairly universally recommended. And so if you're looking at getting started on something, those are probably good ones to start with. Well, there you go. There's a few different sources, all of whom are recommending similar things. So you can feel pretty sure that the kinds of things that I have talked about here today would be good supplements to look into taking. If you're not already taking them, they might be worth a try. But again, if you don't want to try any supplements, if you don't want to take supplements, that's okay too. These are not magic bullets. They are not going to cure anything. They might be helpful, just like any other dietary intervention might be helpful. But you have to make that choice for yourself. And if you want to research any of these things, I have put the links down below, and I would recommend talking with your doctor. If not your neurologist, as I've said, either your primary care doctor or a holistic doctor, a naturopath, anyone in the medical profession should be able to give you some good information. And whether or not you have MS, these supplements could be very helpful to you in maintaining good health in general, which is what we're after. So that's all I have for you today. I look forward to any comments that you want to leave me to tell me what supplements you might be taking or experiences that you have had taking certain supplements, whether good or bad, because sharing your experiences is part of what this channel is all about. Thanks so much for watching. Take really good care of yourself, and I'll see you again in my next video.